Lately, I've been hearing more and more arguments from allopathic physicians that the wellness industry is unscrupulous because they hold eugenicist or ableist viewpoints and essentially promote the position that if you just take a certain supplement or took better care of your health, you would never get sick. And this reframes disease as an issue of moral deficiency. But I think the problem here is the hypocrisy in these statements because allopathic medicine traditionally has very ableist views of their own. A lot of the time, they will ascribe to obesity issues that have nothing to do with weight or BMI. If someone has pulmonary embolism, it gets diagnosed as anxiety, especially when presenting in a female patient. So it feels as though with all the misogyny and obesity bias and racial biases already present in allopathic medicine, there has to be some acknowledgement of just how wrong it really is. I mean, first, remove the plank from your own eye before going after the twig in your neighbor's. And so it just feels as though there are some very real reasons that people look for other answers, especially if they are dealing with complex chronic illness. And mind you, a lot of these medical errors that are due to biases, like writing off pulmonary embolism or a stroke as just anxiety, that can have really, really devastating consequences, including the death of a loved one. So it's not to be taken lightly. So when I hear these arguments that we shouldn't be so ableist, and that's the problem with the wellness industry, I mean, I think the wellness industry exists because of the ableism already practiced by a lot of practicing physicians today. And the idea of female hysteria hasn't gone anywhere either. So I think until we actually are able to listen to patients, really listen to them when they say that something is wrong, there's really no room to be trying to tend to someone else's garden when we haven't taken care of things at home yet. So while I do think that criticism is valid, I think it's also important to practice what we preach first.